Hi everyone. Today we're going to talk about how to communicate with parents who are grieving the loss of their newborn or unborn child. Regardless of the circumstances surrounding the death of a fetus or newborn baby, each woman and partner present is going to go through a grieving process. Some may also have to work through shock and trauma as well. Often the grieving process begins at the hospital. We, the nurses, play such an important role for these patients. They will look to us for support, to be present for them throughout their stay, to give them information about what to expect and what's coming next, and also to provide compassionate care. Now let's go over some things that are helpful for patients to hear, and some things that you really shouldn't say because it could actually lead to further pain. In the next few slides, pay close attention to how I say things. How you communicate with your patients is often more impactful than the exact choice of words you use. So you could start by saying, "I'm so sorry for your loss. If there's anything you need, everyone on our team is here for you. If at any point you have questions, please feel free to ask. I'm here to answer those. If there's anything I can do to make you more comfortable, please let me know. Is now a good time to talk about what happens after delivery, or would you like me to come back a bit later? We will go at whatever pace you're comfortable with. If you need more time or space, that's perfectly fine with us." When it comes to grieving patients, what you say is important, but so is how you say it. So try to keep a soft, gentle tone of voice and a kind, compassionate facial expression. If you're not sure what that looks like, then practice what you want to say in front of a mirror before going into your patient's room. Remember to make eye contact when speaking to your patient. Don't avoid them by looking at the floor or at whatever you're doing. You can keep your arms relaxed at your side or your hands clasped in front of you, and try to sit down at eye level with your patient when giving explanations or talking about a sensitive topic. Now let's take a quick look at some things that you really shouldn't say to your patients. "Oh, it's a good thing you have other children at home. Don't worry, you're still young. You can have more kids. At least your baby died before you knew them well. Time will heal." If your patient and or partner is really emotional in front of you and you're starting to feel distressed, I strongly encourage you to actively listen without saying anything. This will give you time to think before you blurt out something that's unhelpful. Finally, use simple language, no complicated medical jargon. Actively listen to parents, never argue with them, and answer questions honestly. Don't avoid their questions. Taking care of perinatal loss patients is really hard, but it can be very rewarding. Remember that you have a team around you to lean on for support. We're in this together to give the best possible care to our patients.